Ischemic Live. I am your host, Cheryl Walsh. I'm the Director of Communications here at the City of Novi. And I believe it's been about a year since we came to you with our good friends from Ascension Providence here in Novi. And with me on set here at the Civic Center is I want to say Dr. J, but I'm going to say Dr. Grozda. And Dr. Grozda is here to talk about a really important topic, brain aneurysms. And I'm going to show my ignorance because we talked on the phone. And I said, this is great. It's May. It's Stroke Awareness Month. And you were so kind and eloquent to say, yes, it is. And that's great. But we're going to talk about brain aneurysms. And I had to Google because I thought stroke and brain aneurysm were the same thing. And again, you were so sweet on the phone and said, but they're not. And why don't you, even though it is Stroke Awareness Month, and you obviously are a neurosurgeon? Neurointerventionalist. So I'm sure you see stroke patients as well.
Yes.
Why don't you start by telling us a little bit about yourself first, and maybe some of the services and what you do at Ascension Providence here in Novi, and then we'll get into the difference of stroke, brain aneurysm, etc. Dr. Grozda.
So I am a neurointerventional surgeon or radiologist by trade. My training background was in radiology, but three different subspecialties can actually participate in neurointervention, which are neurosurgery, neurology, and radiology. And I went the radiology pathway. I'm also the co-director of the Comprehensive Stroke Center here in Novi at Ascension Providence. And in that capacity, I do, deal with ischemic strokes for Stroke Awareness Month, but there are also hemorrhagic strokes, which are bleeds on the brain instead of where ischemic strokes are strokes where the blood's not getting to the brain. Hemorrhagic strokes are strokes where there's blood on the brain. And an important cause of hemorrhagic strokes are brain aneurysms. So 3 to 5% of all strokes, both hemorrhagic and ischemic, are caused by ruptured brain aneurysms. And that's kind of the topic for today. I think that the big difference again is there's one is blood not getting to the brain, one is blood on the brain. And both of them can be treated by neurointerventionalists. The ones that, the strokes that are caused by blood not getting to the brain, importantly, in patients who qualify, we can give a clot-busting drug through the vein when they present to the hospital if we've identified them as a candidate. And then after that, if they also meet additional criteria and within time frame, we can actually go through the blood vessels of the body up to the blood vessels of the brain and pull the blood clot out. So again, those are the ischemic strokes, the more common kind. And then in the same way, if a patient has a brain aneurysm, whether it has burst or not, we can go through the blood vessels up to the blood vessels, usually to the blood vessels of the leg or the blood vessel of the arm, all the way up to the blood vessels of the brain, and close that aneurysm off using kind of various different, new technological advances are always happening, but it's a metal spring that we put inside the aneurysm, or we can put special stents, which are cages inside the blood vessel that kind of help the blood vessel heal and exclude the aneurysm from the circulation.
So people might be familiar with a stent from a heart, right?
Yes.
So very similar, I would say, you used the word, but in a brain.
Sure.
Blood vessels, blood arteries, am I correct?
Absolutely. Okay. So the ones in the heart are aimed at opening that blood vessel back up. And that's actually kind of the way we deal with ischemic strokes. We use a kind of a device that is a stent. It kind of opens the blood vessel and captures the blood clot and pulls it out. Whereas the stents that we use now for brain aneurysms are kind of made of special materials, and they have very fine mesh in them that helps the blood, the blood flow stay in the pipe and away from the balloon, which is the aneurysm, and helps that heal over.
So my mind is going a mile a minute here thinking stroke, brain aneurysm, signs, symptoms. Like how would someone know or identify if they were having a stroke versus a a brain aneurysm, or are the signs and symptoms very similar?
In certain cases, they can be similar, but in ischemic stroke, we always, the first thing that we say is, does the patient have trouble moving a side of their face? Do they have trouble speaking? Are they having trouble moving a side of their body? Those are signs of any stroke, and that's a sign where you need to get to the hospital. And then we do some special tests at the hospital, including CT scans of the brain and things like that, to determine is it a stroke that had a bleeding, or again, ischemic stroke where the blood flow was cut off. And that's kind of the decision pathway from our standpoint. But it's those initial symptoms when it's an acute change like that, that can be either one. The thing that the symptoms of a ruptured brain aneurysm can include those, but more importantly, they're the kind of the buzzword is the worst headache of your life. If it's an aneurysm that has started to leak, or if it has burst, it would be the worst headache of your life. And other symptoms as far as fainting or a seizure, or pain radiating into the neck from the head, trouble with vision, double vision, blurry vision, things like that. But the buzzword for a ruptured aneurysm is the worst headache of your life, or a thunderclap headache. The unruptured aneurysms, the ones that haven't burst, those can be silent. Those ones that people may not have symptoms. They may also have very, general non-specific symptoms like a headache, pain behind the eye, and then, as the aneurysm grows, you can develop symptoms like the double vision when it starts to actually grow to the size where it presses on, important structures inside your skull, such as nerves and, brain. And essentially you have double vision, blurry vision, but, the majority are silent if they haven't ruptured.
So if I'm understanding correctly, a brain aneurysm could happen suddenly.
Yes.
Or it could be something that is growing, from what you just said, and takes time before it would actually rupture. So
yes.
Is it the same type of aneurysm? Just some people may disregard symptoms, or are there just happens? You had no warning signs at all.
So in some people there can be no warning signs, and that is an unfortunate thing when it happens. But there are obviously those warning symptoms. Other things that would draw your attention to it would be, am I at high risk of having an aneurysm? And the people that are at higher risk are people who have 1 in 50 Americans will have an aneurysm.
1 in 50.
1 in 50 at some point in their life. The majority of those will be of no consequence, may never be found, may never, bleed or anything like that. They may never cause any issue for the patient. But the ones that do, in the an unfortunate subsection, half of those patients do pass away from a ruptured aneurysm. And in the patients who survive, about 2/3 of those have pretty serious neurologic symptoms afterwards. Neurologic, handicap, or some sort of difficulty with their neurologic function afterwards, in 2/3. So it is, it's a major problem, but it's not something that everybody needs to get checked out for. There are certainly people who are at higher risk, and again, those people are people who specifically have a family history. So if there's a first-degree relative that's had an aneurysm or a brain bleed, those people are people that should be checked out. Also, people who, even more higher risk would be people who have family, 2 family members, 2 primary relatives or primary and secondary relative. That's indicative of some sort of genetic, process that's going on that may be causing weakening in the blood vessels and cause the aneurysm to, happen in you. Other people, we know that females are, 1.5 times more likely than males to have them. And then, risk factors for growth and development of aneurysms would be, high blood pressure, smoking, and in general, other things that are associated with ischemic stroke as well, as far as an unhealthy lifestyle. But the biggest things are cigarette smoking, family history, and a personal history. If you've had an aneurysm before, you're also at risk of having another one show up. So,
how about when you say health? How about like sedentary lifestyle? I mean, these are common things, right? Sedentary lifestyle, obesity. Would those things contribute?
Yeah, those sorts of things, certainly they don't cause, we haven't found studies that specifically correlate those things, but obviously those sorts of things are associated with high blood pressure and associated with damage to the internal lining of blood vessels that can form plaque and various different processes within the blood vessels, which causes, more abnormalities, including aneurysms.
So I'm relating this to heart, right? When I think of someone that doesn't have a healthy heart, you look at those things, the plaque or calcium or the buildup in the arteries and in your heart. I would assume, maybe incorrectly, that the same could be said for the arteries to your brain. No?
That can also happen. It doesn't necessarily lead to an aneurysm. It can lead to narrowing of your carotid arteries, and it can lead to narrowing of the middle cerebral artery in the brain and the internal carotid artery in the brain as well. Those can narrow, similar to the ones in the heart. And the aneurysms can be associated with those, but it doesn't have to be that way. Just because they're narrowed, you don't have to have an aneurysm.
Advice. Somebody's watching, they're like, gosh, man, I've had a headache. I need a physical probably. What advice do you give people that are thinking, gosh, could this happen to me? Do they start with the primary care physician, or do they simply they don't call a neurosurgeon and go, hey, I think I'm a candidate? I would assume you start with a good overall physical, or how does that work?
Yeah, certainly one of the things we recommend is healthy lifestyle overall. So, anything you can do to make your lifestyle healthier, controlling your blood pressure, controlling your blood sugar if you have diabetes, controlling your weight, having an active lifestyle, things like that, if your heart is healthy enough and all. But if you're having headaches that are unrelenting, those sorts of things, certainly a primary care doctor is the best first step. I will say that if you have a family member who has had this problem, who has had a brain aneurysm or has had a bleed from a brain aneurysm, that's something you want to kind of contact your family or your primary care doctor and say, I may qualify for the screening of it. And the screening test can be as a CT scan or an MRI. Either one can be done to try and catch an aneurysm before it has bled. And once it's on, your primary care doctor's radar, they can kind of refer you to the appropriate specialist. And in a lot of the cases, we do end up watching, depending on the size of the aneurysm. Obviously, as the aneurysm grows, it becomes more likely to bleed. But we take into account a lot of things, including your risk factors, whether or not we would treat it, or if we should watch it over time.
Okay. The person that's watching that says, I've had one of these. What is my likelihood of having another one? And how do I ensure that doesn't happen?
So I can't give you a definite number on the likelihood, but it's certainly a much higher risk than in the general population.
Okay.
Usually once a patient has had an aneurysm bleed or burst, they are followed by someone like me over the long term to make sure one doesn't pop up. If you have been, if you move to a new place or you lost contact with that physician, it's always a good thing to have your primary care doctor re-refer you to someone that can reevaluate you. Essentially you undergo those screening tests again, depending on how long it's been. But again, the most important things are quitting smoking, having your blood pressure well controlled by taking medications and making lifestyle adjustments.
Are medications like blood thinners, is that something that you use in a case like to combat someone with high blood pressure might be on blood thinners, right? Because of notice difficulty in cardiac care. Does that help with brain function as well, or not the case?
For patients who have specific risks for the ischemic stroke, the kind where the blood flow is not getting, certainly doctors will prescribe blood thinners if you have narrowing in your carotid arteries or if you have narrowing in the blood vessels of the brain. Then you may benefit from having aspirin, and some of the other ones are Plavix or Brilinta, that doctors can prescribe to hopefully prevent the plaque that's narrowing the blood vessel from growing or causing blood clot from forming on those plaques and shooting off and causing a stroke. After we've treated aneurysms, if we use a stent, we'll often keep patients on blood thinners for a period of time, 6 months to a year, depending on kind of their outcome and how things are going, because the stent actually has to heal into the blood vessel wall, and it can, it itself can form blood clots if you're not on the appropriate medications while doing it. So often patients are on that, and we do, tend to keep patients on an aspirin after, even in the long term, after they've been treated for an aneurysm.
So you and I were talking, which is a great segue to talk about the quality of care and the type of care, follow-up care. We were talking, Novi is so proud of many things. I was talking with our mayor yesterday, and he says, we have 12 Oaks, and we have Suburban Collection Show Place, and don't forget, we have Ascension Providence. I mean, we are so blessed to have top world quality healthcare right here in Novi. And I don't want to say we were joking, but we were talking about other facilities around the area, and then we were talking about your credentials and where you were educated, et cetera. But I think it's important, if you wouldn't mind just sharing about the Intervention Center, Co-Director Intervention Center?
Yeah, so Comprehensive Stroke Center.
Comprehensive Stroke Center. Can you talk, because I think it's important for people to realize that they don't have to go downtown, they don't have to go to Ann Arbor. This is care right here in our neighborhood, that in our community that is world-renowned, we do it. We do it just as good, if not better, than anyone else. Can you talk about that a little bit, and then maybe why you chose Ascension Providence?
Sure. And so the Comprehensive Stroke Center is the highest level of certification that any hospital can achieve in the United States for taking care of patients with stroke or neurologic diseases. We have 24/7 and in many cases on-site access to a specialist in the field that can do these highly very advanced procedures, and they can provide care to almost any patient that may present. So that is something that we provide that other places do in the area, but to have it in town is it's kind of a game changer, because in stroke care, every minute counts, and there's an old adage that time is brain, and if you're going 5 minutes, inside your own town, and you have a stroke and you're getting treated 5 minutes away, that does have a big difference than if you have to go an hour, 20 minutes, 30 minutes. Every minute counts. It really does. And having that in town is, it's kind of like an umbrella kind of protecting you to, that if you have this problem, the highest level of care available is right here on your doorstep. And the reason I came to Ascension Providence was to help be a part of that program. It was the Comprehensive Stroke Center had undergone initial certification before I arrived, but I was here to help help build the program and help with the call and help with some of those advanced procedures. Because if you can imagine having the physicians on call 24/7 for something like that. People need a break. So I provide, having, more than one of us, there's actually 3 of us that take the call and do these procedures here in Novi. So, I came here to help build and help maintain, and we did undergo our recertification, got excellent reviews, and That's a testament to the type of team that we have and the resources that Ascension has put into the hospital, and how much the people who involved care. To be honest with you, it's not an easy thing to do by any stretch. Everyone kind of has to buy in. That's part of the team, and we're fortunate that here we have that.
That's amazing. Well, thank you. Nathan, do we have anybody with questions?
We do, actually. So there's quite a few questions coming in for Dr. Gazda. First one that people are asking is, if I have a family history of aneurysms, is that something that I should be concerned about?
Yes. Again, if you have a family history of the aneurysms, it's something that should be brought up with your primary care physician and discuss the possible screening tests, which are an MRA or a CTA, which are MR angiogram or CT angiogram, which actually evaluate the blood vessels of the brain. I usually recommend if that family member had the aneurysm bleed, that the patient be evaluated about 10 years before that, at an age before that. So if a family member had a brain bleed at 50 or 60, then it's not a bad idea to have that screening test 10 years before that age, so 40 or 50. And the same goes that if they had an aneurysm that was treated and unfortunately didn't bleed, it's still a good idea to maybe have 5 to 10 years before that age that they had it discovered to be evaluated for it.
If there were one risk factor that were the most important to control, what would that be? Blood pressure, weight, smoking, or are they all equally important?
Controllable would be smoking. Smoking is the biggest controllable risk factor. And the next would be a high blood pressure. The unfortunate one you can't control is family history, but smoking is certainly the one that causes brain aneurysm, to grow and can cause new ones to pop up.
If I stop smoking, is it reverse? Is that?
If the aneurysm won't, if you've developed one, it won't necessarily reverse. It would decrease your expected risk of further growth. So you can kind of halt, not that you can even halt the progression, but you can give yourself the best chance of having that aneurysm not grow further.
So when we talk about these aneurysms that are growing, I go in, I've got a family history, not a smoker. Hypothetically, I'm not, but even hypothetically for our discussion, I'm not. And you see one. Do you do something about it immediately, or do we watch it? Because you say to halt it from growing. Because I am the type of person that I'm going to say, you found it, let's fix it, right? Like, get it out. What are we going to do about it, right?
Sure.
Why, if it's a ticking time bomb, is there something that can be done, I guess, is the question, from once it's identified? Nathan just said it's not going to reverse. Like, it's not, we know it's there. It's not going to shrink, right? So how do we treat it? Do we have to go in and remove it? Do we do anything, or do we watch it, I guess?
So that a lot of it ends up being on the discussion you have with the physician. But it depends on the size first and foremost, and then those risk factors. So if you have a family history of someone who did have a bleed, it may lead you and your physician to discuss that. Well, even though it hasn't grown or isn't that big yet, we should probably treat it now. Usually, if it's a very small one, we will watch it and kind of go over the symptoms with the patient, if having that headache and things like that, the emergency that comes about it, and we end up doing a test sometimes at 6 months after, depending on your risk factor, sometimes 1 year, and then we tend to increase that interval. So if you have a 2 millimeter aneurysm, that may not require any follow-up if you haven't really had any significant other risk factors. If you have a 4 millimeter aneurysm and you have a family member who had an aneurysm but it didn't bleed, we may say, let's check it in a year. If it hasn't grown, let's check it in 2 years. If it hasn't grown, check it in 5 years. And obviously, at any point, if it grows further, then we go ahead and treat it. There is something to be said also about, if a patient is discussing with their physician and say, I won't be able to live thinking about this aneurysm being there,
That would be me.
no matter how big it is. If the physician and you have a discussion and it's safe, then they may make the choice to treat. But as one thing I always stress to my patients too is that every treatment has a risk too.
Right, it's brain surgery, right?
Sure. So
okay.
yeah, this one's through the blood vessel.
Right.
Aneurysms.
It's not like a magic pill that'll just shrink it or break it up, right?
Yeah, it won't. So it is, over time, the treatment of aneurysms has become, minimally invasive. There are still surgeries done from an open perspective in certain aneurysms.
Okay.
That's a more involved, larger operation. It is brain surgery, but we're doing it through the blood vessel, so patients typically have pretty fast recovery. If the procedure is uncomplicated, patients go home the next day. So
amazing.
Most people go home the next day if the aneurysm hasn't been one of those that bled. If it's one that's bled, then you're going to be in the hospital for a while for various reasons. But if it hasn't bled and we've treated it, usually patients go home the next day.
Amazing. So informative. Anything else?
Yep. If I know someone who's having a stroke symptom, should I have them chew on aspirin or something like that, like a heart attack patient would?
Usually no. We just recommend calling 911 because we don't know what kind of stroke it is yet. If it's the bleeding kind, giving someone a blood thinner like aspirin, although it may be a small dose, it could technically cause increasing in size of that bleeding. So the most important thing is getting the patient, having EMS respond as quickly as possible, or getting the patient to the ER as quickly as possible, so that we can do some of this advanced testing to identify what kind of stroke they're having, and then give the appropriate medication. So it's a time thing that's the biggest key.
If I have a small aneurysm with no risk factors and we are just watching it, can I still lift weights or do strenuous activities?
Oh, good question.
That's a conversation usually you want to have with your doctor, depending on the size of it. But yes, in general, people who have the small aneurysms that we're watching, if you're healthy enough from every other standpoint, you can do that. We don't want to do things that really drive our blood pressure high. But in general, people don't have any restrictions on their life. If the aneurysm's been identified and watching it, you don't really have to curtail normal activities. But again, a discussion you would have with your physician about, I've had patients that come in and tell me very specific kind of things that they're doing, and sometimes you might feel a little worried about it. But it's something that, in general, I don't have limitations for patients who aren't, going to be treated.
Do you have a specialized team at Ascension and Novi to handle stroke care? Yes.
So that's a very important thing, and that's part of the comprehensive stroke center certification. At Novi and our Southfield campus, which is a primary stroke center, we have multiple levels of teams. We recently obtained our stroke response team, which was a big investment from the health system, to have advanced practice providers that are on-site 24/7, and within a minute or two they're down in the ER evaluating the stroke patients and helping expedite their care, and communicating with the whole team. And so that was that's our most recent addition, was this stroke response team, which has really been kind of a godsend in helping decrease some of our times to get the stroke patients the best care throughout the hospital. We also have technologists that help with the imaging and actually in the procedure rooms that are driving from home to get here once the stroke team is activated. We have nursing staff, radiology nurses and other nursing staff that are driving from home as well, on call, coming in to help us and do these procedures. And then there's, we have stroke coordinators and research coordinators and all these people that help us, participate and make sure we're tracking our data and making sure we're staying on top of it. And then a whole team of physicians as well.
So I might put you on the spot here, but when I hear, response team coming in on call, which obviously is a physician you are, a nurse, etc. How many stroke patients do you see on average? And I'm not going to say year, but Do you have one a day? Do you have a couple a week? What?
Often more than one a day.
Wow.
Depending on the type of stroke, it can. So if it's an ischemic stroke, we're seeing a lot a day. Not all of those patients end up needing the interventional procedure that I do, because the blood clot is either too small, or they had a TIA, which is a stroke that kind of goes away, or they have a blood vessel it's kind of too far out for safe procedure, or they're too far out of the time window, those sorts of things. But certainly we're seeing many a day that are presenting as a code stroke, meaning they have new neurologic symptoms and they're identified. And that's often even if they're not requiring any of the procedures or the strong medications, that's kind of where we identify patients that have these risk factors. And this is another risk factor for a future stroke if they've had that sort of an event. We can watch them more closely in the future, or address other things like narrowing of the blood vessels here or narrowing of the blood vessels in the brain.
Okay. Are we good?
Mm-hmm.
We're good. Wow. A lot of information in quite a half hour here, Dr. Grazda.
Yeah, it's an exciting field to be a part of. I'm fortunate to be part of a great team, and it really does have a profound effect on people's lives. And again, having this right in town is a really big deal, to have that world-class care right on your doorstep.
Anything you want to leave us with? We've heard stop smoking. That's the big takeaway tonight. If you're a smoker, please stop smoking. You'll cut your risk factor.
Yep.
Maintain a good blood pressure level. Anything else you want to leave us with tonight?
Yeah, the big thing is always, since it's Stroke Awareness Month, is time is brain. If you notice, if you or a family member or friend or someone that you encounter is having symptoms of a stroke, or if you're having symptoms like the worst headache of your life, those are symptoms of a bleeding brain aneurysm. These are all, as emergent as it can be, and the faster you get to a high-level care facility, the better chances of having a good outcome. And so that's what I leave people with. It's kind of a big team effort, from the general population to our EMS providers to everyone that's involved in the hospital, to combating strokes of all different kinds, and helping people who are, having this very serious problem.
Thank you. Thanks for your time and talents that you share with the community and our friends at Ascension Providence. Again, we are so blessed to have you all in the community, educating the community on important topics like this, spending just a half hour. I am committed to doing more. We said that last year, and we have to do it. There's so many great topics that we can talk about and educate the community in such a simple format. And it's a great way. We started doing this during COVID because it was hard for you to get out and educate the community. I'm referring to you in the larger sense, in the Ascension sense, because of people didn't want to come into a hospital setting, COVID, et cetera. And this is a great way to reach, the millions of people that I know watch Novi television, and to just inform them on these great healthcare initiatives. So thank you for taking the time tonight to join me.
Thank you for having me.
Please send and take our best wishes back to all of our friends at Ascension Providence here in Novi. We are truly blessed to have you guys.
Yeah, thank you for having me, and we're happy to be part of the community.
And thank you for spending a little bit of your Tuesday night with Dr. Grazda and I. I hope you learned a little bit of something along the way. And if you care to find out more information, website is, I'm going to put us on the spot. Go to the city's website, cityofnovi.org, and this video will link you back to Ascension. We'll make sure that happens if you want some more information, because I would get it wrong. So cityofnovi.org for more information, and we will link you back to our friends at Ascension. Until next time, Novi, take care.